While this podcast isn't rated explicit, the content may not be suitable for younger listeners. Welcome to Sex for Saints, the Christian couple's guide to great sex. I'm your host, certified sex and marriage coach, Amanda Lauder. This is episode 364, Pelvic Floor Physical Therapy for Men. Welcome to Sex for Saints, a podcast for Christian couples. My goal with this podcast is to help enlighten, educate, and inspire you to understand yourself, your spouse, and your sexuality better. I talk about sex in a way you probably haven't heard before. I'm bold, I'm direct, but I keep everything in line with my strong Christian values. Are you ready? Let's go. All right. Welcome back to the podcast, everyone. I am so excited to have Katelyn Peach back on here today. Katelyn, welcome.
Thank you for having me again.
Okay, so if you weren't here last week and weren't listening last week, we talked about pelvic floor physical therapy for women. Katelyn is a pelvic floor physical therapist at Wellbeing Physical Therapy in Murray, which is where I go and see her colleague, Val. So we've talked about Val a little bit last week, but I'm going to have Katelyn just introduce herself again, and then we're going to get into today's topic of pelvic floor physical therapy for men, because I feel like this is something that is often overlooked, plays a huge role in sexual function and other things as well. And so I'm excited to talk to Katelyn today. So Katelyn, reintroduce yourself to us.
Yes. So my name is Katelyn Peach. I'm a doctor of physical therapy and I specialize in pelvic floor physical therapy. So I treat all genders, all ages, for any pelvic health condition. So lots of bowel and bladder stuff, sexual stuff, pregnancy, postpartum, lots of pelvic pain. That's what I treat. So, I've been a physical therapist for 5 years and I've always worked here at Wellbeing, and it's my dream job. I love it. I love it here.
Awesome. So if you didn't listen to last week's episode, go back and listen to that one, because we went over some specifics about like what pelvic floor physical therapy is and why it's important and what you need it. And so that gave a good generalization of what it is. But today we're specifically going to focus on pelvic floor physical therapy for men, because we just don't talk about that as much. I think we talk about it for women a lot. I mean, it's getting more and more popular, but men have pelvic floors too, and they have pelvic floor issues. So maybe let's start out. What can you explain again, what it is and why it's important specifically for men's health?
Yes. So pelvic floor physical therapy is like, orthopedic physical therapy. So we're getting muscles, joints, tissues moving that need to move, strengthened that need to be strengthened, and working on, coordination of things. So if you were to get your knee rehabbed, you'd probably, do some muscle mobilization, joint mobilization, and strengthening, right? So it's the same thing, but for your pelvic floor. So um, the pelvic floor is a group of muscles that sit at the bottom of your pelvis and have a lot to do with sexual function, bowel and bladder function. And when things go wrong, we can get a lot of pain, pelvic pain. Pelvic floor is also involved with low back and core issues too. It's all part of the core that stabilizes pelvis. And so all of those things have to work together appropriately to give your pelvis stabilization. So specifically for men, I will say more female patients are likely to say like, oh, my friend saw a pelvic floor physical therapist and she told me that I should see one. Or I think women are more likely to kind of chat amongst themselves of, oh yeah, see a pelvic PT, or like, oh, I pee my pants. And, that I think they're more likely to kind of share that with each other. Whereas my male patients would rather die than tell their best friend that they're having testicular pain, right?
Yes.
So I think they are less likely to know about pelvic floor physical therapy or things that, things they can do to get help. For men, men have pelvic floors just like women do. We have the exact same muscles. The outer muscles are oriented, obviously, just a little bit differently, being around the penis versus around, the opening of the vagina. And then they have a little bit more structures on the outside of their pelvis versus females have it more on the inside. But there's the structures are very similar and need a lot of similar treatment. It just looks a little bit differently for men.
Yeah. So those are some key differences between men and women, right? Like inside structures versus outside structures, that kind of stuff. Maybe let's talk about how common pelvic floor issues for men are and maybe why I mean, you said we don't hear about them as much, I think just because men don't talk about it as much, but why don't we hear about pelvic floor issues for men as much as we do
Yeah.
for women?
I mean, my theory is toxic masculinity. I think men are, I don't know, expected to have, like they're not expected to have pain in sensitive areas or like, like you don't hear men saying like, oh yeah, I pee my pants like a woman does. I think just like
Yeah.
culturally, I think, I don't know, there's just maybe more shame or we just don't expect them, maybe because they don't have babies. So it's like, oh, you don't have babies, you shouldn't have problems
Yeah.
in your pelvic floor. Um, but I think it's so common and so underdiagnosed. So something that I see a lot is my male patients that come see me, they have seen six other providers who have all told them like, oh, like I don't really see anything wrong, or they've given them antibiotics and that doesn't help. And so they're kind of like, I don't know, like maybe it's just in your head, like maybe you actually don't have a problem. And then by the time they come to see me, they've done a bunch of googling and they found that this is a treatment option. And I'm like, yeah, it's your pelvic floor. Like
Yeah. Makes total sense
fixed.
to me.
Yes. Yeah. I'm like, it's not in your head. Like there's a clear issue in your pelvic floor here that's contributing to your problems.
Okay, so what are some signs that a man might have some pelvic floor dysfunction?
Yes. So number one, any kind of pain. So pain with erection, pain with ejaculation, penile pain, testicular pain, tailbone pain, groin pain, hip pain, even low back pain. All of that could be centered in the pelvic floor. Typically, that's a tension issue. So those structures, those muscles are really, really tight and guarded, and it's not getting the necessary relaxation and blood flow. And so we get pain in that area. And I will say, too, that's a very vulnerable thing to say, like, oh, I have like pain in my testicle. Like
Hmm.
it's not easy to just like throw that around.
Yeah.
And it's scary, right? And if you don't know what it is, that can feel really, really scary.
Yeah.
So, yeah, a lot of times we have tension and then that creates pain. And then the nervous system is heightened. So then we get even more guarding, which leads to more pain. And then we kind of get in this cycle. So, for sure, pain, any kind of leaking. So, urinary or fecal leakage, that's a red flag. You should probably see a pelvic floor PT. For my male patients, it's more after they go to the bathroom or they go pee and then they think they're done and then they start to pull up their pants and then they have a little bit of dribbling after. That's typically the type of leakage that I see in my male patients.
Okay.
Um, and then as far as sexual dysfunction, erectile dysfunction is one that I see commonly. Obviously, there's a lot that can go into that, but for sure it could be contributed by pelvic floor,
Hmm.
either pelvic floor tension issue or weakness issue. Um, and then
So
premature ejaculation. Oh,
when you're
yeah.
saying erectile dysfunction, that like are you saying like being able to get an erection, hold an erection, that's what you're referring to?
Yes. Yep.
Okay.
Or pain with an erection.
Or
Yep.
pain with an erection. Great. Okay.
Yep. All of the above. Yep.
Okay.
Um, and then premature ejaculation, a lot of times that's a pelvic floor tension issue. Those muscles are really, really, really tight. And so any kind of stimulation, it can't wait. And then we get the premature ejaculation. So
Yeah. How much does
yeah,
anxiety contribute to that?
so much. Yes. A lot. Yeah, that's definitely one that I'll treat the physical symptoms of that. But then I
Mhm.
think there's also a mental psychological piece that I think needs to be addressed. Not to say it's all in your head, but I
No.
think again our nervous system gets amped up And then it kind of creates another vicious cycle of the
Yeah.
issue.
Yeah. I've
Yeah.
seen with clients of mine that have premature ejaculation, um, a lot of it started out as an anxiety issue and then becomes a
Hmm.
tension issue, and it just kind of cycles and feeds on each other. And so addressing it both from the physiological standpoint as well as the psychological standpoint is really, really important.
Yes, for sure.
Awesome. Okay. Does is there a role in pelvic floor physical therapy that plays into prostate health?
Yes. So I have seen a lot of male patients who have had chronic prostatitis. So they've had, inflammation in the prostate. Sometimes the antibiotics have worked, sometimes they haven't. Either way, they're still having prostate symptoms.
Mhm.
And that is definitely some tension, guarding, and potentially some congestion around the prostate that the pelvic floor is kind of holding on to, guarding around, that needs to be addressed. And then if someone has had a prostatectomy, that's definitely an indication that you should see a pelvic floor physical therapist. So after getting your prostate removed, you're probably going to have some sexual dysfunction, some leakage, maybe some pain. So we need to kind of get all of that back to where it needs to be. When the prostate grows, kind of hypertrophies, it creates kind of a stopper for the urethra. And so the pelvic floor, number one, has a little bit more weight on it. So then it kind of gives up and it doesn't have to engage appropriately for continence. So then all of that is cleared out and our stopper is now gone
Mhm.
and pelvic floor forgot how to work. And so leakage is it's normal for up to a certain point after a prostatectomy, but for sure we need to rehab those muscles, rehab that area,
Yeah.
decrease tension and guarding, and then strengthen things back up.
I mean, when we think about other areas of the body, like if you had surgery or had something removed, like there's always rehab that comes with
For
it.
sure.
And yet we don't hear about rehabbing, your pelvic floor after having your prostate
Hmm.
removed. They're just like, okay,
Yes.
this is what you need to expect and see ya.
Yeah.
And there's so much that can be done to help with that.
Yes.
I've had clients, mostly wives, who have come to me worried, like their husband had prostate cancer, was having their prostate removed, worried about what their sexual relationship was going to look like afterwards. And, pelvic floor physical therapy was never even mentioned in their rehab process. But I also like to tell them to open up their definitions of sex too.
For
Like
sure.
sex is not just about intercourse. There's so much more to
Hmm.
it. And I know this sounds really funny, but a lot of times the example that I use is like lesbians have really good sex. And there's no penetration involved a lot of
Yep.
times.
Yep.
So, like, there's just ways to work around it, but there's ways to work with it too. And rehabbing this is really, really important.
Yes. Yeah. So expectations might be it might look a little different than what it was before,
Yeah.
but for sure we should rehab and, maximize function as much as we can.
Absolutely. Okay, so
Yes.
what happens during a pelvic floor physical therapy session for men? We talked about it for women last week,
Yes. Yeah.
right? So let's talk about what it might look like for men.
Yeah. So similarly, I do kind of an ortho screen. So I look to see how your spine is moving, how your hips are moving, in general, how your pelvis is stabilizing, kind of zooming out from the pelvic floor. And then same thing for men as women. I check abdomen. So I see if there's any abdominal scarring, abdominal tension around organs. Um, and then to do a pelvic floor exam, in some ways that's a little bit easier because there's a lot of structures on the outside, right?
Yep.
So I'll normally start by checking the external pelvic floor muscles externally. So those are the ones that sit in between sit bones. So I'll normally start there. Um, I'll check inner thigh muscles, inner thigh and pelvic floor kind of work together. And so we'll check the muscles around pelvic floor and then external pelvic floor. And then if it's indicated, I'll check mobility of fascia around spermatic cord, um, or on the shaft of the penis. And so I'll just feel those tissues, feel how they're moving, see if that reproduces symptoms or is tender or tight or in any way. Um, and this is my style. I normally don't do an internal exam on a male patient on the first visit. A lot of times that's a time constraint thing, but a lot of times too, there's a lot we can do externally first to kind of get things to be able to relax and move and open before we have to go internally. So depending on the patient, we'll either do an internal exam, second, third, fourth, on a subsequent visit, or never if that's what they feel comfortable with. But for an internal exam, we go rectally instead of vaginally. So just one gloved finger, lubricated through the rectal opening. And then I'll go in and palpate each individual muscle of the pelvic floor. And that will give us a great idea of muscle tension, muscle function, if there's any weakness or coordination issues, and then we can do treatment internally as well if needed.
So I would imagine that this would be a really hard thing for a man to go through.
Yes, for sure. Yeah. They're so many of my male patients have said, like, I feel so vulnerable right now, right?
Yeah.
Like
Yeah.
having a stranger, like, hold my junk in their hands, or like having
Yeah.
having a stranger's finger up my bum. Like it feels very vulnerable.
Yeah.
So I try and be as sensitive as possible, um, and like be reassuring. And of course, I'm always taking it at their pace. If they're like, you are not sticking your finger up inside of me, I'm like, great, okay, we don't have to do that. We
Yeah.
don't have to do it today. We don't have to do it ever if that's what you're comfortable with. Most, I would say most of my male patients, by the time they're here, are like, do whatever you need to me, do whatever you need to do to me. I just am done with this. Like, I just want to get better.
Yeah.
So,
Yeah.
yeah.
I mean, I think as women, even though it can often feel invasive, it's something that we've just been like told our entire lives that this is part of being a woman, like having
Yes.
people up all in your business and
Yes. Uh-huh.
stuff like that. And so but that's not necessarily the case for men.
No.
Um I think maybe just even addressing the maybe the elephant in the room. I don't know. Like, do men often get aroused when you're doing this?
Yeah, that's a great question. And I tell my patients because they will get nervous about it. And I
Yeah.
say that is a completely normal physiological response to what we're doing.
Yeah.
In fact, if we're having issues there, that's a great sign, right? I'm mobilizing tissues. I want blood flow to the area. And so if you get an erection, I always say, I'm not offended and I'm not flattered. Like that's just
Good
part of
answer.
what happens.
Yes. Yeah, I mean,
Like
I like it
yeah.
doesn't mean anything. It's just a
No.
physiological response, right?
Yes. Yes.
And I think we need to normalize that part of it, that
Yeah,
there are things that happen just as a normal physiological response that don't mean anything. And while it may feel vulnerable and embarrassing, this is something that you see all the time, you're used to. It's
hmm
actually part of the exam, I would say, just because you need to see how things are functioning.
yeah,
And so nothing, even though it's normal to feel embarrassed, you don't need to feel embarrassed about it.
for sure. Yep.
Yeah.
Yep.
Okay. What are some of the biggest maybe misconceptions that men have about pelvic floor physical therapy?
Yeah. I would say the biggest one is they don't have a pelvic floor. But we already
Okay.
talked about that.
Yeah.
Yeah, that it's like just for women, or they don't they don't have a pelvic floor, or they don't get pelvic floor issues. Um, I think sometimes too, like men are perceived, which a lot of times like men are really strong, right? Like
Hmm.
I'm strong and so it's fine, right? Like my core is strong, I have really strong abs, I'm okay. Or I haven't had a baby, or I haven't had any like one-time injury that I need physical therapy for. Um, but I think number one, strength is not always the only thing that matters, right? Like we've talked about, a
Yeah.
lot of these issues are tension based.
Yep.
Um, Therefore, a lot of these issues are not necessarily from an injury or from a one time thing. It's from chronic anxiety, chronic tension, chronic stress that these issues have been building up a lot over time.
Yeah. Like, do you have, if men have a lot of stress in their life, I would imagine that they're holding a lot of that stress in their pelvic floor and they don't even realize it.
Probably. Yeah. I think it's an easier example of like, oh, when I get stressed, I feel my neck tension and my shoulders
Oh,
tighten,
yeah.
right? A
Yeah.
lot of people can feel that, right? That's easy to touch and feel.
Yeah.
I think in the same way, a lot of people store stress and tension in their pelvic floors and like in their abdominal muscles without even noticing.
Yeah.
Especially if it's, and we talked about this last time, like relationship stress or relationship trauma, that is a lot of times stored in the pelvic floor.
hmm And, I know men will ask, okay, well, are there exercises that I can do at home to strengthen or relax their pelvic floor? But I would guess that it's the same answer that we talked about last week is that they really need to see someone to know if they need to strengthen it or learn to relax it because
Yes,
you probably don't know the difference yourself.
for sure. Yes. And so I don't know what, one specific person might need without an examination. And the other thing too, if I just tell someone, oh, relax your pelvic floor, they could be like, am I? I thought I was relaxed. I don't know how to relax that. So
Yes.
it's really helpful to get on those pelvic floor muscles and be like, this is the muscle that I need you to breathe into. They're like, whoa, I've never even felt that muscle in my whole life. So
Yeah.
that's another really important piece of making sure that we are relaxing or contracting the correct muscles.
Yes. Yeah. So, we talked a little bit about like erectile function, right? And erectile function can be a symptom of both tension and like need to be strengthened, right?
Hmm.
Like, what would we see? What would you maybe see if it was too tight? And what would you see if it needs to be strengthened?
Yeah. So I would do kind of similar of what I was talking about before. I would do an examination of checking number one tension. So if I touch a muscle, does it feel tight? Does it reproduce pain? Does it reproduce any symptoms? Can we relax it completely? And then similarly, when I feel a muscle and I ask for a contraction, what do I feel there? So do I feel a really good lift and squeeze? Do I feel just like a little flicker of a squeeze? Do I feel like a squeeze and then it lets go 1 second later? So there's an endurance piece. Um, or if it's tight and then they try and squeeze it, it has nowhere to go. So it's kind of like a tension weakness problem, which
Mhm.
I would say most people have a little bit of both that we have to work through. So
Yeah.
a lot of times I'm working through tension first, so getting full range of motion, and then we can strengthen now that we have the full mobility that we need.
Okay. So, can men use pelvic floor therapy to enhance orgasm and maybe like prolong, that piece of like not having an orgasm for a while
Yeah.
before I know like with premature ejaculation, we define that as like less than like 1 minute, right?
Hmm.
But if they wanted to prolong that even past the minute mark or whatever, would that be something that they could work on in pelvic floor therapy?
Potentially, yeah. If there's some deficits, like we talked about, intention, coordination, strengthening,
Mhm.
that could definitely be something we could work on, depending on what deficits we're finding in the examination.
Okay. How does aging impact the pelvic floor?
Yeah. Just like aging impacts the whole body, right? Like we get a little less muscle tone, right? So like muscle strength kind of
Hmm
decreases with age. Um, we get potentially more tension, right? If things are kind of falling, if things are, decreasing in strength, sometimes tension increases to try and make up for the decrease in strength. Um, Definitely erectile issues start to get worse and worse with age. And so I always tell people like, it's like if you're training for marathons, right? Like when you're in your 20s, you could probably train for a marathon and be just fine, like not really need a tons of external support. Versus if you're training for a marathon in your 50s or 60s or 70s, we might need a little bit more help, right? Like maybe sturdier shoes, maybe a little bit more trips to the physical therapist, like more stretching,
hmm
um, maybe more like nutrition things that we're working on. So I'm always like, I am here to support you in your goals, whatever that may be. and I'm going to do the best I can to support your body wherever it's at. But it may just need a little extra help with age. So that could be um, like some pills, some medications, could be some mental health physical therapy along or mental health therapy along with physical therapy.
Hmm.
But yes, it's definitely we might just need more help as we get older.
Yeah. So, as we end today, thank you so much for being here and thanks for sharing
Yeah,
all this. Is there anything else you think we should talk about or we should know about pelvic floor therapy for men?
yeah. One thing that I actually thought of something that would bring someone to me is inguinal or umbilical hernias. So
Mm.
that a hernia is where tissue is being kind of pushed through a hole that it's not supposed to. So I I kind of relate hernias in men to prolapse in women. So when we have increased pressure or tension, that's kind of pushing stuff into a hole where it doesn't belong. We need to work on pressure management, strengthening, tension management to make sure that those tissues are not being, pushed down. So that was just another condition that I thought of.
Okay.
And then if someone has had an inguinal or umbilical surgery, a hernia repair surgery,
Yeah.
there's scar tissue now that we need to address that to make sure that that's not causing issues. Um, and then addressing some behavioral things so that because if your body was prone to get a hernia before, we don't want to have another hernia again, right? So making sure that our body is doing things that's not leading to another hernia. So
Yeah.
that's another common condition that I see.
Good.
um, but as far as like overall wrap up, um, I would say if you have any question of whether you should see a pelvic floor PT or not, just call a local pelvic floor physical therapy clinic and ask, say like, hey, this is what I'm experiencing. Is this something that you treat? And if they do treat men, they should be able to help you, help get your questions answered, and they should be able to get you help.
Yeah. I mean, I know I've seen men in your office when I've been
Yeah.
there as well.
Hmm.
So, I know it's something that you definitely see, but if they don't live in Murray or if they don't want a woman treating them, if they would rather have a male physical therapist, where would you suggest that they go to find that?
Yeah. So pelvicrehab.com is a great website. It's a directory of pelvic PTs. And so you can just put in your area and all the pelvic PTs will pop up. Um, I would say definitely call and ask to make sure that they do treatment. I could get on a soapbox here. There are some pelvic PTs who just don't treat men, and I think sometimes that's just like a training thing, like they just haven't been trained to treat male patients. And I think sometimes that's a them issue that I think they feel uncomfortable with it or they're like scared that all men are perverts and like something's going to happen in this treatment session. I don't really know. I think all pelvic PTs should treat all genders. That's just my little soapbox
Yeah.
rant.
Yeah.
So, but there are pelvic PTs out there who don't treat men for whatever reason. So just call the clinic and make sure, like, do you treat male patients? And they'll be able to give you, or looking at someone's website, it should be pretty clear of who they treat.
Yeah. Well,
So
one thing that I've always appreciated about you and Val is just your openness to treating all genders and people and
yeah,
being very accepting, but keeping it, totally appropriate. And, I mean, this is medical. Like, this is not,
yes,
like you see bodies all day, every day, just like gynecologists do, just like urologists do, like doctors
hmm
do. Like you are a doctor of physical therapy. So, this isn't anything inappropriate or sexual in
nope,
any nature whatsoever.
nope,
It's just really about the body and treating the body and making it function the best way
yes,
it
for
can.
sure.
So, well, Katelyn, thank you so much for being here today. Just will you remind people where they can find you? Because I would love to send as many people to you as possible.
Yes, I would love to see any and all patients that want to come see me. So I am in Murray, Utah at Wellbeing Physical Therapy. We have an Instagram page and a Facebook page that you can see more about us, or you can look on our website, wellbeingphysicaltherapy.com.
Awesome. Thanks so much for being here, Katelyn.
Thank you so much for having me.
All right, my friends, I hope you found these interviews with Dr. Katelyn Peach so helpful and learning more about pelvic floor physical therapy for men and women. Please reach out to her or another pelvic floor physical therapist in your area on pelvicrehab.com if you need any more help in this area. And if you're wondering if they treat it, it's better to ask them. We will see you again next week for another new episode. Bye-bye. Like what you're hearing on this podcast? Make sure you hit subscribe so you don't miss a single episode. Don't forget to leave me a review and share it with your friends.